This is breast cancer. It doesn't care who you are, how much money you have, your race, your religion, or ethnicity. It does not discriminate. It is a cancer that is estimated to kill over 40,000 women this year.
Cancer is your own cells that have gone haywire.
This abnormal growth of cells interrupts the growth of normal cells and can cause vital organs to fail. Hearing all of this is very scary. It was especially scary for me. When I was 7 years old, my mom, Leslie Crichton, was diagnosed with breast cancer. Luckily, it was found early and she battled cancer and won. She, along with her friend Deb Zaharides, both survived breast cancer and are now sharing their story with me.
Well, I'd just taken my son to school, and I'd gone to Target to meet a friend of mine.
My husband was traveling, and I was cooking dinner for my 3 boys.
By the time I was ready to leave the store, I found I had a message.
I remember getting a phone call from my doctor.
And she asked me, "Are you somewhere where you can talk?"
I remember the doctor telling me that I had cancer, and
I told her I was sitting in my car, and she told me that it was cancerous.
just took down all the information and kind of acted normal.
And, I needed to go ahead and schedule an appointment with a breast surgeon.
I was cooking, my kids were right at the counter, and I didn't want to worry them at all, so I didn't talk about it right away. I knew I needed a checkup, and I was a little bit nervous about it.
I went for my annual mammogram, and I was called back. I actually found out that there was a mass that should not be there, and I had a biopsy done and found out that it was malignant and had to be removed.
Before 40, we do different screening. We'll either do a mammogram, which is like a X-ray of that tissue, or we'll use ultrasound or aspiration.
Well, I wasn't surprised when they told me there was a mass. In my gut, I kind of felt like it might be cancerous. It was very difficult. I had a 7-year-old son, and I saw my life flash before my eyes. The doctors told me that I would live, and that was a relief.
They did a biopsy, and then the biopsy determined what type of breast cancer it was. And my doctor, I recommended a lumpectomy. She said I could do a mastectomy if I wanted to. And it was a stage 1 form of cancer. It was 1 lump. But based on the biopsy, the cancer was a strong form of cancer, so I also had to have chemotherapy and radiation with that.
Some people will get radiation to that chest wall, they'll get chemotherapy, or not at all. It just may be just removing just the lump. Most times we're finding them when they're very small, so typical treatment is just local excision, meaning you just remove that part out. Radiation in particular will kill both the tissue, right? So it kills good and bad tissue because it destroys the reproductive capacity of those cells. But it also causes the blood vessels to shrink down so that they're so small that even more damage occurs. So all cancers require a good blood flow to continue to grow because they're kind of like haywire, right? So they want to grow, grow, grow. They need lots of nutrition. So one of the ways you stop cancers is by stopping the blood flow to them.
But breast cancer is treatable. However, the treatments to get rid of the cancer are not forgiving.
Well, I lost my hair, which is always traumatic for women. That was one of the biggest things. I got weak. I lost weight. The taste was very awful in my mouth. Everything tasted kind of metallic, and that's probably the reason I lost weight, because food didn't taste good. It wasn't appealing.
So chemotherapy works on fast-growing cells by causing an interruption in their reproducing. The reason people's hair fall out and the reason they have bad intestinal side effects from chemo is because those are also fast-growing tissues, right? So anything that grows fast is damaged.
I had my surgery, then I had 6 rounds of chemo, and that was, I think, every 3 weeks, and then I had radiation after that. So my recovery period wasn't for probably about 9 months until I kind of was on the path to recovering.
It probably took about a month for the first surgery because I wasn't allowed to drive, and so it probably took about a good month. But then 2 months after the initial surgery, I had the second surgery, but that one was a much easier surgery to recover from.
Really, the breast cancer community is a big support because there's so many events out there and so many people. So it's other people that have gone through it before. My mom wasn't around. My husband was a big support. And the activities that especially occur in October are really supportive.
Well, the first surgery, my husband helped me. My father came up to take care of my son because he was only 7 and I couldn't take him to school. I couldn't do a lot of things. So my father helped. And on January 5th, 2009, my cancer was removed, so I was cancer-free at that point.
Every year is critical, and every year is kind of scary when you go back and have your mammogram. My 5-year, I think, was a pivotal point for me. I felt like, I've overcome something, and we had a big celebration. And then, of course, 10 years was another pivotal moment.
So 5 years is a huge mark in survivorship, and 10 years is even more huge. And I hit my 10-year milestone January 5th, 2019.
The final step in recovery is helping others. Many other women are currently battling breast cancer, and the support of women who have already fought and beaten the cancer help patients during their treatments.
I am always available to talk to other women who have been diagnosed with cancer. Whenever I hear of someone that has been diagnosed, I always tell my friends or whomever, please tell your friend or your parent, your mom, your sister, that I'm available. I would be happy to talk with them, and I've talked to many women over the years because it's something that is scary. It's something that there's a lot of questions that doctors don't answer. Sometimes as patients, we don't know what questions to ask our doctors, so it's helpful to have a survivor who's been through this to be able to talk to other patients and explain to them some of the things that they might encounter that their doctors don't prepare them for.
While breast cancer is a very dangerous and deadly cancer, there is hope for survival. Even though there is no cure yet, the stories of survivors such as Deb and my mom give hope to those currently battling breast cancer.